Start.
Hello, I'm Dr. Trivedi. I'm a doctor working here today. May I confirm your name and age, please?
Yes, doctor. My name is Seva Kamel and I am 54 years.
Okay, how may I address you?
You can call me Heba.
Okay, Mrs. Heba, today we are going to discuss about your health issues. Will that be okay?
Yes, doctor.
Okay, and during our conversation, I might take some notes down, which will be strictly confidential. Is it all right?
Okay, doctor.
Okay, but can you, Mrs. Heba, can you please tell me in your own words what have brought you here today?
Yes, doctor. It is not a new problem. I am suffering from this for last 18 months. That I am having breathlessness, and it is progressively increasing. And now it has become so severe that I even cannot walk 100-meter distance. And even if I do my household works like some washing or vacuuming, then I feel shortness of breath. That is making my life very difficult, doctor.
Yes, I'm very sorry to hear that. We'll try our level best to find out the cause today. Can you please tell me that at 18 months back you started to feel this problem? Did this breathlessness come along suddenly or slowly, gradually? Can you please tell me?
It was gradually, doctor. Initially, I felt on exertion, on excessive exertion, not on this type of mild exertion. And after over the last 18 months, it is progressively increasing, and I am becoming intolerant to more activities, doctor.
Yes, I can understand it. Can you please tell me that is it present all the time, or does it come and go, this shortness of breath?
It comes when I do any activities like walking for a while or doing some exertional job. Then I feel this pain. It doesn't present during my sitting position or during rest.
Yes, I can get that. Do you do you have to use extra pillows at night? What do you think about it?
No, I usually use one pillow.
Okay, is it okay when you go to bed? Do you feel any type of shortness of breath?
No, not at night. Just when I do any exercise, any work, then I feel this.
Okay, and do you think that anything makes it better? Just rest. Apart from rest, does anything make it better?
I haven't noticed anything.
Yes. Okay. That's all right. Can you please tell me that do you feel any racing and pacing of your heart?
No.
Okay. Can you ever noticed? Have you ever noticed that is there any leg swelling present or not?
No.
Okay. And do you ever feel any pain in your chest? In chest pain?
No, I haven't noticed such pain before.
Yes, that's all right. Do you have you ever felt any cough?
No, not something significant.
Okay. And any tightness in your chest or any noisy chest?
No.
Okay. And have you ever felt any raised temperatures?
Not such like that.
Okay. And may I ask you some other questions now? That do you feel any headache?
No.
Okay. Any problems in your vision?
No.
Okay. And any rashes anywhere in the body?
No.
Any soreness in your mouth or anywhere in the body?
No.
Okay. And may I ask you, what about your water work?
Yes, doctor. That I had a problem with my water work. That was about 10 years ago when I first have this symptom. Then I recurrently had infection in my urinary tract, And then I visited my GP. He treated several times with antibiotic, and after that, after finishing the antibiotic, the urinary tract infection came again. So he put me on long-term antibiotic, that is 50 mg per night, and I am taking that over last 10 years. I cannot remember the name actually. I'm sorry for that.
Okay. So you told that you first had this around 10 years back. Well, can you can remember that what brought that type of problems in your water work, or what were the symptoms at that time? Can you please remember?
Yes, that time I had burning sensation and frequent micturition.
Okay. And over the time, has this changed, these symptoms?
After taking the antibiotics at night, I am feeling better, and I haven't felt such symptoms after continuing this antibiotic. And initially, when I had recurrent episodes of UTI, at that time, after finishing antibiotic, about 4 weeks or 2 months after finishing the antibiotic, the urinary tract infection came again.
Okay. Did you have you all the time taken the same antibiotic, or have you changed it? Can you remember?
No, for the last 10 years, I am taking the same.
You have been taking the same antibiotic. Well, and how many times have you been to the physician for this issue?
For urinary tract infection, I didn't find anything abnormal after taking this medication. And so I didn't visit for this, but I visited my GP for my breathlessness.
Okay. And the dose has been always the same?
Yes, all the same.
Okay. And okay. And can you remember that whether you have had any issues with your with your with your urinary tract before that 10 years? Any childhood problems? Do you know of any of it?
No.
Okay. Okay. And do you have any, can you tell me that, do you feel any lumps and bumps in your tummy now?
No.
Okay. Any significant weight loss? Have you noticed it?
No.
Okay. And how many times do you have to go to for your water work nowadays?
Maybe 5 to 6 times a day.
Okay. And do you feel any type of burning sensation now, or
No.
has it been all right?
It is all right.
Okay. Okay. Can you please tell me that, do you feel any weakness or numbness in any part of your body?
No.
Okay. Any tingling or pain in any parts of your body?
No.
Okay. Any problem in your balance? Have you ever felt?
No.
Okay. And okay. And may I ask you some other questions now? Do you have anybody in the family with such type of shortness of breath or similar illnesses?
No, but my husband had TB at when he was child, and not.
Okay, your husband had TB.
Yes.
Okay, and was he under regular follow-up?
He took treatment because it was at his childhood, so I cannot tell you much about that.
Okay, can you please tell me that how is your husband now? Does he have any problem in his chest? Any issues with his in his breathing?
No,
with his breathing?
He's fine now.
Okay, that's all right. And okay, and for how long have you been married? May I know, if you don't mind?
About 25 years.
About 25 years. Okay. May I ask you some personal questions? That have you? Do you have any? I'm very sorry to ask it, but I'm to ask. Do you have any casual partners other than your husband?
Never.
Okay, that's all right. I'm very sorry to ask you. And may I know that do you smoke? This is also a very personal question, but I'm sorry to ask. Do you smoke?
Yes, doctor. I am having a lot of stress at my family life and my work. So actually, I smoke.
Okay,
I usually smoke about
okay, okay, okay. May I know how many sticks per day?
about 20 sticks per day.
Yes, it's very well. I'm sorry to say, Mrs. Heba, that it is actually very harmful for your health. So it would be better to stop smoking, and I would like to refer you to the smoking cessation in unit if you wish to. Is it okay?
Okay, doctor.
Yes. May I also know that do you take any alcohol?
No, doctor.
Okay, that's very good, very appreciable. And have you ever taken any recreational medication?
No, never.
Okay, and may I ask you that I'm sorry to ask that which you have been on one medication, and do you have any? Have you been on any other medication or just one?
Just one.
Okay, and are you allergic to any medication? Do you know of it?
I am allergic to a medication that is called elastoplast, and I don't know much about that.
Sorry. Can you please repeat?
It is called elastoplast. I don't know much about that medication.
Oh, okay, I can get it. And can you okay? Can you tell me that have you ever been diagnosed with any other chronic disease, long-term disease like diabetes, pressure, or anything like that?
No.
Okay. May I know about your? I'm sorry to ask that. May I know about your menses? Has it stopped or is it going on now?
It is stopped.
It has stopped. Okay. For how long?
Last 3 years.
Okay. I'm sorry to ask, but I have to ask it. Okay. And may I know that what job do you do for a living?
I am a nurse, doctor, and I work at a hospital.
Okay. Okay. I get it. And okay. And may I know that uh, how this problem is hampering? Is this problem hampering your job life or anything like that?
Yes, doctor. I am. I cannot make my job as I was before because I was a very active person, but now it has made my life to a limited situation. It is confined
Yes. I can get it.
situation.
Yes, I'm very sorry to hear. And okay, and okay, and I will talk to the social services so that they can map out a plan for your betterment. And may I know whom do you live it with? I think your husband. Am I right?
Yes, doctor. I am my husband and I have 2 children.
Okay, and okay. And do you think that you need any support financially or socially?
Actually, doctor, I need only my health to be better because on my young boy is having cerebral palsy, and I need to take care of him. I need to take care of my job, so it has become difficult for me with my current condition.
Yes, I'm very sorry to hear, and I can understand your problems, and I would like to uh, get you linked with the social services as soon as possible. And may I know that what are your concerns are? What your concerns are?
Yes, doctor. Why I am having this? Do I have some heart problem? You asked me about that.
Okay. Well, without I can actually confirm it after examining you properly, and also taking some detailed making some detailed assessment of you. But at this moment, it might be that you have been taking a drug, and this has you have been taking for quite a long time, and at times this drug may cause some problem in your chest, what we say in the lungs, and so we are not sure about it at this moment, but it might occur that this drug has caused some problem in your chest, and we will have to confirm it by doing some scans and also some blood tests and some other tests, some exercise tests as well. Okay, and we will also inform the lung doctor, and also at the same time, to exclude any heart problems, we will also run some tests of your heart, some scanning of your heart, and some electrical tracing also. And we will also involve the lung doctor and chest doctor. And and after evaluating all this, we can be sure about it, and we can be sure about it. And I'm also going to involve the social services and occupational services to look after you, that how they can help you more in this matter. Are you getting me, Mrs.
Yes,
Seba?
doctor. Yes.
Okay. Do you have any more concerns?
Are you going to give me any medication for this time, or are you are waiting
Yes,
for?
yes, I can get it. Well, okay. Since we are thinking that this problem might be due to the medication you have been taking, so we will involve our consultant, and he might and uh, we might encourage you to stop the medication for the time being, unless we evaluate you properly and find out the cause. And then once we find out the cause, it would be easier for us to prescribe you a correct medication. Is it all right, Mrs. Seba?
Okay, doctor.
Any more concerns?
No, doctor. You have explained everything well.
Okay. Okay. So thank you. Thank you,
Thank you, doctor.
Mrs. Seba. Okay.
Okay, so
Yes.
what is your diagnosis?
I think that this is this might be a case of pulmonary fibrosis due to long-term nitrofurantoic intake.
What are your differential?
The differentials maybe that she has some she might be having some uremic pericarditis also due to her long-term uh, urinary tract infection. She might be, if it's not under control, she might be having uremic pericarditis, I think.
Anything else?
And uh, not that can I remember now. I'm sorry.
That's not a problem. How are you going to investigate her?
Well, I think I'm going to at first do some basic tests, some routine tests, including CBC with ESR, CRP, and then renal function test, urea and electrolytes, and also I will go for test PA view and do the lung function test, including peak flow meter and spirometry. And then I will also, of course, go for ECG and echo, and also then go for ECG and echo, and also then go for some exercise test to see the oxygen level. And finally, I would also like, which is very specific, to do the CT scan, HRCT, high resolution CT scan.
Okay. Fine.
Okay.
So for this lady, she had history of shortness of breath. For this, you have asked about onset. That was fine. Then character of this breathlessness, you have asked it. Then associated symptoms, you have asked it well, as that is any chest pain, chest tightness, pacing of heart, any signs of heart failure. You have asked the timing also well. You have asked eliciting an aggravating factor, and you have asked the severity, how much severe it is. That was a good point. And after that, there was something that you should have asked in the past history. You have asked it well. In the drug history, it was fine. In the family history, that was also fine. In the personal history, you should have asked about more about his more about her sticks per day and for how long. You haven't asked for how long. So you
Okay.
count back here.
Yeah. Yes, yes.
And
Yes.
also one thing she mentioned that she is having some stress. So you could have advised any consultation with psychiatrist.
Yes, yes,
She's
yes,
a
I can get
nurse.
it. Yes, yes, that was a mistake.
And one thing in the that is in the job, she is a nurse and she has allergy to certain chemicals or medication. You
Mm.
could have asked that what do you mean by allergy and when did you notice it, so you could have get a better idea.
Yeah,
Actually
yeah.
it was some synthetic product that is used in the OT, just like some strip or band-aid. She's allergic to that. Okay. So you
Okay.
get a better idea. Then as a respiratory case, you should have asked about her pet and
Yes,
travel history.
yes.
Okay.
Mm.
There are certain other thing that you should have asked about her weight sense.
I asked that.
Okay, I cannot remember. Okay, so you got that.
Yeah, yeah, yeah. Yes,
It's
that's
not, okay, in the differential, there are your diagnosis was fine. That is nitrofurantoin induced pulmonary fibrosis. There are other alternative diagnosis, that is extrinsic allergic alveolitis. If you have asked about pet at home, then I would say that yes, I have a dog at home. Okay, and her taking of cigarette for a long time also give a
mm.
possibility of chronic obstructive pulmonary
Mm.
disease. And
Mm.
also
Mm.
this
Mm.
can be a case of chronic heart failure. This can be a case of pulmonary hypertension.
Mm.
Okay.
Uh, yeah. Mm.
And she has visited the doctor. So you could have asked that what test was done and if they have found anything, they have found anything abnormal with the test results. That would give you more better idea into the condition. Overall performance was good.
Yes, uh, I should have asked much more. Okay, so actually, expensive allergy and alveolitis, chronic heart failure for why? Why would I have to keep it there? Chronic heart failure.
It's, as this patient have history of long-term progressive shortness of breath. So
Okay.
chronic heart failure is a differential because heart cause chronic heart failure may present with this, and
Okay.
also has bivagal crepitation.
Yeah. Yeah. Well, I have one question that suppose there is some description here, like bivagal crepitations. Okay. So when I'm telling the DDs, okay, I am telling the DDs according to the history. But here I have it
And
has
in
been
the
mentioned
history,
that
patient have history of long-term shortness of breath.
yeah,
So
yeah.
long-term shortness of
But
breath comes with, there are more other differential that would also come. Like this can be a case of severe anemia. There are a lot of possibilities, but according to the history,
yeah.
I think chronic heart failure would be a, more differential. You haven't asked about fatigue, pallor.
Uh,
It's not a big issue.
yeah, yeah. Okay, okay.
Would have asked.
I can get yeah, yeah, I can get it, but it should have been asked also. Yes. Okay. So thank you.